Do you often feel unusually tired after a light walk, or even after a good night's sleep? Or maybe your right side under the ribs feels a bit heavy or tender. If yes, it might not just be stress or aging. It could be a silent sign of something going on inside your liver. Now you might think, I don't drink alcohol, so I'm safe, right? Not exactly. There's a condition called non-alcoholic fatty liver disease, NAFLD, where fat builds up in the liver, even if you hardly or never drink alcohol. It's more common than you think. Millions of people worldwide have it, and many don't even know it. Think of your liver like a kitchen in your body's house. If the kitchen gets cluttered with too much grease fat, it can't cook properly, do its jobs. That's what happens in NAFLD. Your liver gets overloaded with fat, and if not checked, it can lead to serious damage. So what causes this fat to pile up if it's not alcohol? Great question. Picture this: imagine your body is like a car, and sugar, especially from sweets, sodas, and white bread, is the fuel. If you keep pouring fuel into the car but don't drive much, meaning you're not active, the engine gets clogged. That's similar to what happens in your liver. The main culprits of NAFLD are being overweight, having high blood sugar, like in diabetes, high cholesterol, or high blood pressure. These together are often called metabolic syndrome. Even if you're not obese, you can still get NAFLD if you eat a lot of junk food and sit all day. Genetics can also play a role. Did your mom or dad have diabetes or liver issues? That might increase your risk. Think of it like inheriting an old phone that overheats easily. Your liver might just be more sensitive to fat buildup. Now here's the tricky part. NAFLD often doesn't shout its presence. In fact, most people feel just fine at first. No pain, no alarms. It's like a thief sneaking in quietly. But if you pay close attention, some clues might show up. Do you often feel tired without reason? Is your belly a bit puffier than before? Some people notice a dull ache on the right side, just below the ribs. That's where your liver is. Others might get dark patches on the skin, especially on the neck or underarms, like a strange tan that won't go away. But remember, many people have zero symptoms. That's why it's called a silent disease. Imagine a leaking pipe behind your wall. You won't see the damage until it bursts. That's why catching NAFLD early matters. Since NAFLD doesn't give clear signs, how do doctors find it? Often by accident. For example, you go for a blood test for something else, and the liver enzymes like ALT or AST come back high. That's like a warning light on your car dashboard. The doctor might then order an ultrasound, a simple scan using sound waves, and see if your liver looks bright or blurry, which means fat is present. Sometimes, more advanced scans or even a liver biopsy, a tiny needle to take a small sample, are needed. Now, what about treatment? There's no magic pill yet, but the best medicine is lifestyle change. Remember that car with too much fuel? Start driving it. That means losing 5 to 10% of your weight if you're overweight. Cutting down on sodas, fries, and sweets helps a lot. Daily walks, even 30 minutes, can start reversing the fat. In some cases, doctors may suggest medicines for diabetes or cholesterol, which also help the liver. Can you stop NAFLD before it starts? Absolutely. Think of it like protecting your phone from crashing. You wouldn't just download apps and never clean it right. Same with your liver. Eat more real food like vegetables, whole grains, and lean proteins. Replace soda with water or herbal tea. Move your body, dance, walk, play with kids, do anything that gets you breathing a bit harder. Even standing up every hour at work helps. Avoid fast food and processed snacks. They're full of hidden sugars and bad fats. And get regular health check-ups. If you're diabetic or have high cholesterol, keep those numbers in check. Small steps every day build a strong liver over time. Good news, scientists are working hard on NAFLD. Imagine a future where a simple blood test or scan can tell exactly how much liver damage you have, without a needle. That's what new tools like FibroScan or blood biomarkers are aiming for. Researchers are also testing new medicines that target liver fat and inflammation directly. For example, some drugs help the body use insulin better or reduce liver fat buildup. There's also growing interest in gut health. Yes, your gut bacteria. It turns out, a healthy gut might mean a healthier liver. Probiotics and special diets, like Mediterranean diet, are being studied for their liver benefits. So, while there's no cure yet, the future looks hopeful with better tools and treatments.